Okay. Good morning. I'm Megan Pearson, the Chief Communications Officer for Kern County, and this is our Thursday morning briefing related to COVID-19. Today we have with us our Director of Public Health, Matt Constantine, who's joining us virtually. We have our Chief Administrative Officer, Ryan Alsop, and we also have a couple people available for questions. So Kim Hernandez, our lead epidemiologist, is here as well. So we're going to go ahead and get started, and I'm going to ask Matt to go ahead and start with his public health briefing.
Good morning, Megan. Thank you. Everybody can hear me okay?
We sure can.
Okay, thank you. Good morning. This morning, Public Health is reporting that there are 4 new deaths in Kern County residents, and there are 50 new cases as of today. I want to spend just a few minutes updating the group on Kingston, the Kingston Healthcare Center. The state has reported to the county as of May 12th that the census in the facility is 107. So there's 107 residents in the facility. The state is reporting that there are 49 healthcare workers that have tested positive for COVID-19, and there are 67 residents cumulatively that have tested positive for COVID-19, and there are 11 residents that have died from COVID-19. It's again important to understand that this is a state-regulated facility. They have the authority and responsibility to ensure that the infection control procedures are in place and that the facility operates safely. So it's a state-regulated facility. As we've mentioned previously, they did ask for some additional resources because their staffing was insufficient. We were lucky enough to have the state send in a medical assistance team, a CalMat team. The original deployment was for 14 days, and that deployment would end this Sunday. They have agreed to extend it another week until Sunday, May 24th. So that's good news. Kingston has reported to Public Health that they are hiring approximately 20 new employees this week. So our expectation is the additional staffing will help and eventually allow the CalMat team to return. But we're going to continue to monitor that very, very carefully. There are other skilled nursing facilities in the county. There's 19 that the state regulates. There is another facility called Valley Convalescent Hospital that we are tracking closely. They have reported to the state that there are some positive cases, and they have reported some concerns with staffing. The state has told us there are 69 residents at that facility, that there are 7 healthcare workers that have been tested positive for COVID-19, and that there are 9 residents that have tested positive for COVID-19. Yesterday morning, Wednesday morning, Valley Convalescent Hospital did reach out to us and asked for staffing. They indicated that they had a shortage in staffing, and they put in a request yesterday morning for 14 licensed staff members to assist them with their daily shifts. That request has been received by Public Health. We are looking to see if there's any local resources that we can divert to Valley Convalescent. If we are unable to meet that request, we will send that request up to the state either today or tomorrow and ask for their assistance. Again, this is a second site we're worried about. We've monitored it closely. This is something that is a concern to us. It is obviously the obligation of the skilled nursing facility to provide that service and the state to oversee the safe operation. But we're here, we're going to help. We were notified today, too, that FEMA has indicated that they're going to provide enough personal protective equipment for every skilled nursing facility for a 2-week supply. They're indicating that they will deliver those shipments of PPE next week, the 20th or the 21st, for a 2-week supply, and then reevaluate if additional PPE is needed. So that's a help, and that is a concern to a lot of our local skilled nursing facilities. And then finally, with skilled nursing facilities, the state has put out a requirement that all skilled nursing facilities must develop a COVID testing program for all residents and all staff within 21 days. That went out May 11th. However, we don't want to wait on the county level. We're concerned that's too long. We want to intervene now. So Public Health has hired 3 additional staff that began this week. They will start testing at local skilled nursing facilities beginning Friday. Our first stop is Valley Convalescent Hospital. We are going to test the 118 staff members that are there over Friday and Saturday, and then beginning Monday, we will then visit other sites. So that's a local program that we are administering at our cost, because we want to make sure we identify those that are positive way in advance, and we don't want to wait that 3 weeks. Yesterday, we also received the new FDA-approved antiviral, Remdesivir. The state received an allocation. The state then allocated to the counties, and yesterday we received a small dose, enough for 2 2/3 of a person. We distributed that within hours to 2 of our local hospitals so that they could administer it to those that were in greatest need. It's unknown if additional dosage will be coming our way. We're hopeful that it will, and we want to make sure we get that out to those that need it the most. And finally, in my area that I wanted to cover quickly is testing, our testing sites. We have 10 sites that we will have fully up and running in the next few days. So just briefly, there are 4 state-sponsored sites that are currently open. Those sites, you must have an appointment in advance. But as of yesterday, the state has removed all screening criteria. So all are welcome to come. We have the one at the fairgrounds, one in Mojave at the Veterans Hall. We have one in Arvin that is opening today. And we, of course, have the drive-through facility on Mount Vernon at the Prado Senior Center. We have some county-sponsored sites that are also operational. We have 6 sites that we are intending to completely open soon. Currently, we have Oildale that is open at Good Samaritan Hospital. We have Taft at the Westside Healthcare District that is operational. And coming online in the next few days will be Delano at the Delano Regional Medical Center, and in Ridgecrest at the Ridgecrest Hospital. And then finally, next week, we hope to see 2 additional sites coming online at the Kern River Valley Hospital and at Tehachapi Hospital, at the Adventist Hospital in Tehachapi. Our county-sponsored sites have the same now criteria as the state. There is no criteria, there's no charge. On the county's website, there is a link to all of these sites and how to make an appointment and the hours of operation. They vary because we're trying to allow the greatest ability for our community to access testing. Megan, that concludes my comments. I'll turn it back to you.
Thank you, Matt. Now I'd like to introduce our Chief Administrative Officer, Ryan Alsop.
Thanks, Megan. Hello, everybody. Good Thursday to you. Appreciate having the interpreters here again today with us. As we manage through how we're combating what many people have termed this invisible enemy, which is COVID-19. We're also managing how we begin to transition back to work and greater economic activity. Those of you watching at home, I know you are stressed, you're concerned, you're wanting to get back to some normalcy in your lives. You are dealing with your kids and teaching them. I know my wife is. We are all of the county staff that are involved in this are all residents of this community and have obviously normal lives, children, families to care for outside of our work here. And then we come to work and are dealing with this. This is all-consuming on a daily basis here at the county. And so I want to thank our public health department, our public health director, his staff who are working around the clock. I want to thank our EOC staff, the Emergency Operations Center staff who are working around the clock, doing very hard work, managing this throughout the county. And I want to thank our first responders, our sheriff's deputies, our firefighters, and everybody else in the county, all of our county employees who are handling essential functions day in and day out. That business does not stop, even in a pandemic, and I want to thank you up front. Here in Kern County, as we approach nearly 15,000 tests that have been administered for those presenting symptoms or have been exposed to those preventing symptoms related to COVID-19, nearly 80% of those tests have been determined to be negative. Of the nearly 2,000 tests that are pending results, the vast majority of those are likely negative. In many cases with negative tests, our public health officials have to get on the phone and do extra work seeking out confirmation of those negative tests. There is not a requirement that we get a call, public health gets a call, to verify that a test was negative. There is a protocol and a requirement for positive tests, not for negative. So we can't just assume that those number of tests that are not positive are negative. We actually have to go out and confirm them. So I wanted to make that clear. I know that the media has been good about communicating that. Here in Kern County on a daily basis since late March, tracking the numbers, 96% of those residents who've tested positive have either fully recovered, this is on a daily basis, have either fully recovered or are recovering at home, treating their symptoms on their own. I think those are important stats for everybody to know. We're in stage 2 of the governor's reopening plan. There are several stages of reopening. Within stage 2, he has talked about multiple phases, moving through those. He plans on moving the state through those based on data, based on science, as he said, based on the advice of his public health team. And our ability as a county to move quicker through those phases of stage 2 depends on guidance that he has provided counties. We have been given that guidance. Right now, we are not in compliance with all of the parameters of that guidance. There are 2 parameters in particular that are problematic. Matt just talked about 4 additional deaths today and 50 additional cases today. Under the governor's parameters, we are to have no more than 90 deaths in a 14-day period before we can submit our attestation to the state of California. We can have 0 deaths over a 14-day period prior to us submitting our attestation for the state to then consider allowing us to move forward quicker than the governor does through these phases of stage 2. Now, we believe that there is room for improvement in those 2 guidance points. We believe that different methodology, consideration of a different methodology there is something that the governor needs to be considering. We are in discussions and had a great discussion yesterday with all of our area hospitals, our 10 county hospitals and their top physicians. And we are talking collectively about how we respond to the governor's guidance. We are working with them to make the case for Kern County. We are suggesting that a better measurement should be based on the rate of hospitalizations per day related to the, as compared to the total number of positive tests, as a better indicator of our preparedness to begin to reopen. If you recall, flattening the curve that we've all seen, that was specifically to describe how we manage the spread of this virus. It is not about how we eliminate this virus. It's about managing the spread of this virus and managing the available hospital capacity so that we don't overwhelm the medical system here in Kern County. We are doing that well here. We have plenty of capacity in our hospitals. In fact, our hospitals each have plans in place at their own locations to do an expansion of that capacity. We also have an alternative care site set up at the Kern County Fairgrounds that's ready to go now with 48-hour notice for up to 250 patients at a time. We are prepared. We will be continuing to work with our medical community, our top physicians in this community to make the case to the governor. We will build consensus among that group, and we will do that together. We appreciate all of them for their work, their time, and their support going forward as we continue to seek greater local latitude to move more quickly through the governor's plans. We continue to have discussions with industry groups here in Kern County with our ad hoc advisory committee made up of 2 members of our Board of Supervisors, Supervisor Scrivener and Supervisor Maggard. We are focused on getting all businesses reopened that can reopen under the governor's directives as quickly as possible and in the safest and most responsible manner possible. I want to tell folks listening, businesses listening, there is a tremendous amount of information and guidance for your businesses and your industries in particular on the governor's website. That's covid19.ca.gov. It's covid19.ca.gov. I would encourage you to go on there, look at what the governor has planned for his various stages. He tells you where we are currently, what his plans are to move forward, what you should be doing now to prepare to move forward, to what you should be doing now to operate. If you're not operating, how do you get prepared to jump when he is ready to allow you to begin to reopen? We'll have a board meeting on Tuesday, this next Tuesday on the 19th. We are going to be discussing with the board, that agenda will be out later this afternoon. We're going to be discussing with the board financial assistance for small businesses in Kern County. That will be covered in detail on Tuesday. It's something that we've been working on with a group of local financial institutions, and we thank those organizations and individuals that we've been dealing with for all of their support. We've been working with chambers of commerce, the Hispanic Chamber of Commerce, the Greater Bakersfield Chamber of Commerce, and others, the small business group out of Cal State. We appreciate all of that input. My message to you is this: restaurateurs, we are coming for you first. We are prioritizing you first in this county. If you are a small restaurant and you are in need of assistance, we are going to be proactively reaching out for you. We are prioritizing you first, and we are going to get this money to you as soon as possible. That is our plan. Again, we'll be talking to our board members about this on Tuesday. If you have any questions, and particularly if you are a restaurant Anywhere in this county, we ask you to reach out to us if you'd like right now. Reach out to your local Chamber of Commerce right now about this. But we will be, if we don't hear from you in the meantime, you can rest assured that you are going to hear from us here in the coming days, and I would ask you to look for that. Budget issues we'll be discussing again at the board meeting next week. The county is facing, like every other municipality in this country, significant revenue shortfalls. We are projecting significant revenue shortfalls across all of our business units, not only in this current fiscal year, but in the subsequent fiscal years. Certainly in fiscal year 2021, that budget planning process is happening now. Significant revenue shortfalls. The state has released information a week or so ago. The governor talked about how the state will be dealing with a $54 billion budget deficit. The state's May revise will be out later this afternoon, probably around noon or 1 o'clock. We're going to be reviewing that. Keep in mind, many of the county services that we provide are sustained through the pass-through funds that are provided through the federal and state governments. So the governor's May revise will give us a window into what the next fiscal year is going to look like, and even more information about what it is we will be dealing with. At the board meeting on Tuesday, we'll be talking about these numbers, and we will be walking our board through a series of short-term recommendations and longer-term recommendations that this county will be taking to deal with these anticipated revenue shortfalls and bridge, whether that's a short bridge or a long bridge, to better economic times. Those will be here again, but we just don't know the timing on that, and we have to plan quickly and prudently and be prepared as a county, and that's what we'll be doing and discussing with the board on Tuesday. Last press briefing, I talked about how we are in an essential staffing only mode here at the county. We have been since March 17th. We had an end date on that, which was May 15th. That date is approaching. I want to be clear on what our plans are for the county in terms of a quote-unquote return to work. We will continue to be on essential staffing into the week of May 18th. Essential staffing into the week of May 18th. However, beginning on May 18th, we're going to begin the process of transitioning the county to begin reopening certain facilities and certain services to the public. That involves bringing certain staff people back. There will be, this is going to be a multi-week transition. There will be some county services and business activities that get started ahead of others. Some departments opening a little wider than others as we transition over the course of the next many weeks. And we are going to be basing this reopening on a couple of factors. Number one is we've got to make sure that all of our business units, all of our departments in each of their areas have a work site specific plan that is developed, it's implemented, and it is sustained, and they can demonstrate that it can be sustained to protect county employees and to protect the public, particularly those of us here employed by the county who are most predisposed to serious health risks due to COVID-19. So having those plans in place will be important, and we'll be working with our departments to ensure that those plans get implemented and are practiced going forward. Obviously, returning back to work, whatever that looks like, and it will be different depending on what department that you're in. It will be based in large measure on the budget issues that we're facing. We know that we're going to have some significant revenue shortfalls, so reopening a particular county business function will be based on the realities that we're facing financially. What we were doing on March 16th before we went to essential staffing could look very different when a county department and certain business activities within that county department reopens. We're going to be applying our best practices learned during these lean times. We are learning how to work more efficiently, and we're going to have to pay attention to the budget situation and to make sure as we get back to business that we're accounting for these significant revenue shortfalls that we are anticipating. Finally, I just want to say, folks, I know each of you watching, you may have a little voice in your head telling you to go outside and get that run in or get that walk in or go out and ride your bike. You've had that little voice inside your head for a while. This is a good time to listen to that voice and go out. Go outside and enjoy yourself. The weather's fantastic. I ran this morning early. The weather was beautiful. This is the best time to get out and enjoy the weather. Take a walk around your block. You don't have to stay isolated in your home if you are not dealing with COVID-19 or the symptoms of COVID-19. Go out, take a walk. Obviously, stay away from folks. Keep a healthy distance. Do it smartly. But I would encourage you all to get out and enjoy the weather while you can before it gets incredibly too hot here in our county. Thank you very much.
Thank you, Ryan. Okay, now we're going to take questions from our media. A quick reminder, *6 to unmute your lines. If you have an open feed to either this briefing or another briefing in the background, please mute that before you come off mute because it creates feedback for all of the listeners. There is a suggested order that we take these questions in, so I'll go down the list and see if you're available and ready for your question. First up, we have Channel 29. Is there anyone on the line that wants to ask a question?
Yes, please.
Hey, Tim, how are you?
I'm not doing too bad. How are you?
Doing well, thank you.
Good. I wanted to ask Mr. Alsop, he mentioned that some of our restaurants are going to be the first ones that the county is going to help. We've been hearing from a lot of restaurants that they're under the impression that they can open as soon as next week, like Monday. We actually talked about that in our morning meeting this morning. Now, we don't know where necessarily they're getting that from, if they're maybe misunderstanding some information. So what is that process going to be like, Mr. Alsop? I know you said that you guys are going to start reaching out to them in the next coming days. Do we have a more concrete timeline or an explanation of what that is going to look like?
Yeah, let me turn it over to Mr. Alsop to answer that.
Hey, so we have been in contact with restaurants. In fact, we've held a fairly sizable call between our ad hoc committee, public health, and a group of restaurateurs that are really spread around throughout the county of different sizes and scope of business, and had a good call. Restaurants are under stage 2 allowed to provide takeout and delivery services, and that is where they stand. Any restaurants that decide to open their doors to allow in-room dining, getting back to that, would be doing so out ahead of the governor's current directives. The later stages of stage 2, again, we're in kind of phase 1 of stage 2. I know this is complicated, but the governor is saying as he determines how we move through these various phases, later stages of phase 2 could see some movement for restaurants to begin under a certain set of guidelines that the governor is providing, begin to allow people back inside for inside dining. And there are some very rather direct, strict protocols on how to do that. The governor has made those guidelines available to restaurants. We have provided those guidelines to the restaurant group that we had on the phone. We are putting that information out through various social media sources. We are directing restaurants to look at those guidelines. But right now, restaurants cannot open more widely in operations than they currently are operating under, and it will be subject to, again, either the governor moving us through these phases or the governor providing the county greater latitude so that we can begin moving more quickly to get those restaurants open. Again, I've explained why we're unable to do that at this point, but we're working on it. So I hope that answers your question, Tim.
Yes, thank you, sir.
Thanks, Tim. Next, we'll go to Channel 17. Is there anyone online wanting to ask a question?
Hi, yes, this is Kern. Hi, Ryan, Matt, Megan. I had a few questions about the testing sites that I wanted to clarify. First, you said that there was a fourth state-sponsored testing site. Can you just clarify where that is?
Yes, that testing site is in Arvin. It's just recently opened. I believe they started testing today. So today is the first day that they're taking appointments. The address is available on kerncounty.com, where all of the COVID testing sites are listed.
Great. And we spoke with Supervisor Leticia Perez yesterday, who said at the 5th District drive-thru at the Prado Senior Center, you can get tested for free as many times as you want. She's trying to make it more part of a routine for residents before there's a vaccine. So at the other the 6 county-sponsored sites, will there be a limit for how many times you can be tested for free?
No, there isn't a limit on how often you can be tested. We ask people to follow the guidelines that are provided through CDPH and the CDC. The only requirement is that you wait until your test results have come back from any previous test. So those have to be clear, that you have to have received your results before you can schedule an appointment for the next one.
Got it. And final question, just how exactly do you determine if someone is recovered? Is it mandatory to retest and get a negative, or can they just kind of walk out of their house after 14 days?
Karen, we can either have Matt or we have Kim Hernandez, our lead epidemiologist, answer that. Matt, who would you prefer to have that one?
I think Kim would be much better to be able to answer that specifically.
Okay, so let me have Kim answer that one.
Thank you. Good morning. To answer the question about when we determine a patient has recovered from COVID-19, our public health nurses are in constant contact with cases as they are going through their progression of illness. When they meet the CDC's criteria for release from isolation, they are then released by public health off of isolation. They are considered at that point to be non-infectious and no longer a public health concern. We encourage all of our patients to continue to follow up with their healthcare provider to determine when they have fully recovered from a medical standpoint to ensure that they are indeed back to where they were before their infection. Thank you.
Thank you.
Thank you, Kim. Do we have anyone from KNZR on the line? How about KUZZ?
Yeah, hi Megan, it's Rob King from KUZZ. How you doing?
I'm doing well. How are you?
Good. I was wondering, as things start to heat up, if we're going to have any sort of different guidelines regarding cooling centers.
So I'll field this as best I can, Matt, unless you want to answer that one. I do have a little bit of information based on what we're doing from the Emergency Operations Center.
Please, Megan, go ahead.
Okay. So we are looking at our cooling centers as we approach the warm summer months because we do have concerns about those being open and they have to operate within the social distancing guidelines. So there are plans being created now to look at how those facilities operate. We're also making sure that Our utility partners are aware of where those are, and we're going to try and help spare them from any public safety power shutoffs if possible. That's not always the case, but there are a lot of conversations going on now to make sure that the cooling centers are well thought out and that we are prepared for any social distancing guidelines that would be required should we have to open them.
Okay, so we do still plan to, as of now, plan to open them.
Yeah, the plan will be if we need to open them, we will. We just have to make sure that we can provide the social distancing needs for our residents that use them.
Got it, thank you.
Mm-hmm. Anyone from the Bakersfield Californian on the line?
Hi, yes, this is Stacy. My question is about the county's effort to, get the state to be a little bit more flexible with these two indicators. Or I guess Ryan was saying maybe look at a different indicator of hospitalizations rather than the cases and the deaths. I just wondered, is it just Kern County who's asking for that sort of consideration, or is Kern hoping to, convince the state to make this something that, all counties could use as an alternative metric, I guess?
Right, let me have Mr. Alsop answer your question.
Hi, Stacy. I would hope that the governor would consider making it a parameter, a methodology that could be used by all counties. The bottom line on that is that we are seeking local flexibility, greater latitude. These two parameters, these two provisions are problematic. The 90 in the 14-day period is problematic. At the same time, the state is asking us to ramp up testing. We are ramping up testing in this community. Matt has spoken today about 10 testing sites that are for free, that don't have any requirements. You can go and get tested as many times as you want. You don't have to have symptoms. We are going to be testing 2,000 or more people in this community a day. The numbers of positives are going to increase. They will increase as we go. And so the guidelines they're a little confusing given the fact that we are needing to ramp up our testing per the state. The state has made that a requirement within the same set of guidelines. It's a little confusing. And so the approach that we are taking, it's not in a vacuum. It's not just us here at the county, public health and my office, trying to figure out how to do this. We're consulting with the medical community here in Kern County, and we're going to be working with them going forward. The people that manage the various hospitals throughout Kern County, in addition to the top physicians at each of those hospitals, getting feedback from them, being on the phone with them, walking through these guidelines, and working together to make the case to the governor on a potential change on those two areas. So I hope that answers your question, Stacy.
Yeah, thank you.
Thank you. Do we have anyone from Kern Radio on the line?
Yes. Good morning, Megan. It's Ralph Bailey.
Good morning, Ralph. How are you?
I'm good. How are you?
Doing well, thank you.
Wanted to ask Ryan, I guess I wanted to follow up on the previous question. I've talked to 3 different restaurant owners who have said they've been told privately by elected officials there would be days before they could do limited in-restaurant service. Given the fact that you said we're not even close with those 2 categories, and you're talking about greater latitudes and making the case, are you guys negotiating some sort of waiver or exception to those? And can you tell restaurant owners who are told it could be days how close those negotiations are Because based on these guidelines, it could be weeks upon weeks before they're able to open.
Ralph, let me have Mr. Alsop answer your question.
Hey, what's up, Ralph? To answer, answer the question, I'll try to do as best I can. We are not telling restaurants that it'll be days. I know that the governor has made some comments in recent press conferences that he's held and made some statements. You can find quotes online. I saw a couple where he talked about a matter of weeks and not months to moving through further phases of the stage 2 and then, approaching consideration of getting into phase 3. And so the governor has said that, that seems to be the timeline. Keep in mind that our ability to accelerate through this on our own is hampered by these parameters that I've been discussing that we're engaging the governor on to provide some changes to so that we can do that. Unless we're able to accomplish that, this is entirely, the schedule on this is entirely up to the Newsom administration. He and Dr. Ghali up there and his public health team in deciding how the state as a whole begins to move through these stages. So if you're a restaurant, you should be doing delivery and pickup. I know most are. I'm doing my part to order each week at various different restaurants, supporting them. Stay in that mode. We are going to remain in contact with you to not only make you aware of some stimulus funding that we're going to make available to you ASAP, but we want to make sure that you understand the current guidelines that you need to be operating under and these guidelines that the governor just announced a couple of days ago for restaurants to reopen to in-person, in-house dining. He has put out, I think, a couple of days ago, the guidelines on that. However, he has not moved restaurants into a place where they can begin to utilize those guidelines. So restaurants should be figuring out right now how they're going to be operating within those guidelines at least when the governor says go. And in the event that the state allows our county to allow that to move forward faster than what they're currently planning. And again, our ability to do that depends on our ability to navigate through these problematic 2 parameters that, again, we're talking with local physicians about on how to make those changes and suggest changes to the governor on that. So I hope that answers your question, Ralph.
Are you seeking some sort of waiver or exception to any of the guidelines?
We are not legally able to waive anything that the governor has directed at all. The governor as I said, he's calling the shots on this, and we are doing our best to open every single business that we can reopen. There's, as I've said before, there are some businesses that fall within a gray area. They're not specifically listed on the people who are essential, and they're not specifically listed on the list of businesses that are supposed to be closed, that are non-essential. They fall within a gray area. We're working at breakneck speed to get all of those businesses that fall within that area open ASAP, working under guidelines provided by public health. That is the current local flexibility that we have. It's limited to that, and we're making sure that we're getting those businesses back up and running. But no waivers. The only sort of waiver that we have available would be through this attestation that the county would submit to the governor, saying that we can meet all of these directives that he is telling us that we have to meet in order to accelerate through these phases of stage 2. And again, currently we are not able to meet that on just a couple of provisions, and we're working to change that as soon as possible, and we're going to keep you updated on our success and/or failure in that area in the days ahead.
Thank you. Do we have anyone from Channel 23 on the line?
Hi, is this 23's turn? I could not hear.
It is. Go ahead.
It is 23's, okay. So just to clarify, this is not my question, but I do just want to make sure that we have the numbers correct. So to clarify, did 78 residents of the 107 total residents at Kingston test positive for COVID-19 now that you just mentioned that 11 people have died at the facility?
So Matt, I'll have to ask you to answer that one. I don't have the numbers.
Of course. Yes, of course. So I think the question was how many positive employees and residents were at Kingston. Did I hear that correctly?
Correct. It sounds like. Go ahead, Tori, if you could say that one more time just to break down the numbers
Okay.
you're hearing.
Yeah. So we were told that, I believe, that 107 total residents are there. And that's 7, and then we, based off the numbers it seems, with the new people, the number of people that have died, it seems that 78 total residents have tested positive for COVID-19 at Kingston. Is that correct?
So yes, thank you. So from the state has provided us numbers as of May 12th. So I'm a couple days late. They haven't given us an update since May 12th. I show 107 residents in the facility, that there are 49 healthcare workers that have tested positive and 67 residents that have tested positive. That's according to the state that they've given to us.
So 49 workers tested positive and 67?
Residents, yes ma'am.
Okay. And then, so what about the 11 that have died? Are they included in the 67?
I would assume the 11 that have died are included in the residents' cumulative number from the state, yes.
Okay, are included in the number. Okay, sorry, I was just taking some notes. And then my actual question, and we have been talking a lot about businesses and stuff, and what we've been hearing is that the alcohol beverage control station has been revoking some licenses. So we're wondering if you guys are aware of any state licensing boards that have pulled any licenses from local businesses.
So that could, Matt, are you aware of any, and I'm not sure if you're hearing the question. The question was, are we aware as a county of any state agencies that have revoked local licenses? And I'm not sure that we would have that information, because obviously that would have been conducted at the state level. Matt, do you have any information on that question?
No, I have no specific information, no.
Okay, so would that come from the state?
That would, you'd have to contact those specific state agencies for that information.
Okay, and then honestly, I only have one more question, so if that's okay, but if not, then I can wait.
Go ahead. Sorry, go ahead. There may be a delay in what you're hearing, so go ahead.
Okay, yes, there's only one more question that I had. So Mr. Olsop was talking about, obviously, this methodology that he's hoping to put in the eyes of the governor, and he was talking about some of the county services that would be included in that transition. So my question becomes, can you guys give an example of something that would be included in a county service, realm that would be able to transition sooner? And specifically, I guess my question would be an office building. Is that an example of something that you guys would be considering in the realm of a county service that could be transitioning? Because if so, then that would technically be part of phase 2. So I'm just trying to get an example of what type of county service you guys are considering transitioning early if possible, if he considers this hospitalization situation.
So Tori, I just want to make sure I clarify a couple of things. You're asking about the county's plan to phase out of our essential staffing only model, and how our offices as a county, where they fall in our plan to phase out of the essential staffing model. Am I understanding you correctly?
Yeah, I'm just wondering if an office building specifically, because that's just something I would want to know would be considered a county service that would be able to transition out.
Yeah, so there's
If
some
that's what you're
dynamics
talking-
there, and I'll pitch it to Mr. Alsop, but you also have to remember that the county our functions are an essential service, so they don't line up as well with the stage 2 and the phases that roll out. So I'll let Ryan respond to any more to that.
Yeah, thanks, Megan. Yeah, I mean, just to be clear, when we're talking about phase 2 and the stages, we're focused on the private sector, getting our private sector folks back to a greater business activity as quickly as possible. Talking about the county is a separate thing. To your question, we're going to be trying to do this smartly. We're going to base it on our ability to keep our employees safe, keep the public safe, particularly those people, employees, and members of the public who fall within a category where they are at greater risk due to COVID-19. We will be determining which county services get open. Obviously, operations like the Sheriff's Department, we've got fire season approaching, the fire department, our district attorney's office, the courts are reopening in some capacity on next Monday, I believe. And so we've got activity like that over at the district attorney's office where we've already are having employees there. The DA is bringing her employees back in some capacity to deal with the work that they have to do. This is all going to be done with a phased and careful approach based on worksite specific plans to keep people safe. But again, also it's going to be done thinking about revenue shortfalls. Again, and I want to be real clear about this, the county of Kern is facing significant economic fallout from the response to COVID-19. It's not just the response to COVID-19. We have the added blessing of having a heavy dependence on oil. And the price of a barrel of oil has tanked. It is very, very low. That has an impact on our property tax revenues. We are going to be in for quite a long-term exercise here in the county in dealing with this so that we're maintaining critical services, dealing with these revenue shortfalls. We're not alone. Everybody's going to be in the same boat, but it's quite sobering what we are looking at and seeing, what we are projecting. Obviously, lots of things can change. It depends on what the economy does and how soon it does it. It depends on what the state does with their budget. It depends on the status of the virus here in this community. It depends on what oil does. It depends on whether or not the federal government decides to provide local governments like Kern, like the city of Bakersfield and other municipalities with some sort of stimulus to help us through these times. They're debating that. So a lot of things can change, but again, we're planning for the worst. And in many ways, what we're projecting is much worse than the economic situation the county just came out of. So we're all in good spirits here, I got to tell you. It's quite an exercise for us to stay focused, to continue to be positive. We continue to seek and pursue optimism here in Kern County, no matter who we are, whatever businesses that we're involved with, the services that we're providing to you. But it is sobering, and it is going to be certainly probably the most significant challenge that I faced as a leader in local government, in my time as a leader in local government, pulling out of this. So thank you in advance for your support.
Question has been answered at all. So I don't think the question's been answered at all. So,
I didn't hear what you said.
I'm just going to point out, I really don't believe that the question was essentially answered at all. The only thing that I got
Okay,
out of
give me
that
your,
was
give me your
the
question.
thought-
Please give me your
Yeah.
question and try to make it as clear as possible, and I'll try to answer it.
Okay, so from what I
Good.
understand, because I've been following along, let me preface this a little bit. I've been following along with Governor Gavin Newsom and reading through the phases and the different parts of it, as you know. One of the parts of the second part of phase 2 is office buildings. And from what I understand, what you just mentioned, because I was taking notes, is for the DA's office, essentially the courts are going to open back up starting very soon.
They're
And an
essential.
office-
They're an essential business.
I understand that's essential, but I'm an essential worker and I'm working from home, so I understand that. And I understand, I just want you to know, I'm not trying to be rude, I'm just trying to make it clear that an office building within the county, essential businesses, the DA's office obviously would be essential, is not gonna have workers working remotely and is going to essentially overlook the fact that phase 2 that office building would fall under phase 2, and you're just gonna keep it moving.
I'll try to answer your question. I don't know what the DA is going to do. She runs her business. They have to be back because the courts are opening. She's going to decide how she does that and what personnel she does that with. I would assume that there are some that may continue to work from home. She is an essential business. I'm sure she's going to be working with us to make sure that she's got plans in place so that when she does begin bringing back more and more employees, that she's got a plan in place to deal with, to the best of her ability, the safety for those employees and the public. But again, you keep talking about county office space and county services, and what I'm telling you is that as far as I'm concerned in how we're managing this, we're not listening to the governor on how we reopen. We are an essential service. We can determine which business activities in the county are essential and which are not. And what I'm telling you is that aside from the phase 2 and the governor's rollout, which is predominantly focused on the private sector, we're going to be phasing back to more full service of the county. We're transitioning, and we're going to be doing it carefully. Not all departments will be opening. Some will be opening ahead of others. This is going to be a multi-week transition, and it's going to be, again, be based on work site specific plans that we have in place, the ability to demonstrate that we can sustain those work site specific plans that keep people safe, and it's going to be done based on the budget situation that we are dealing with, because coming back to work and putting things back online are going to look, because of that, are going to look different than they looked as recently as March 16th. And so I hope that that answers your question.
Okay, do we have anyone from Kern Soul on the line? And last up, do we have anyone from the Mojave Desert News on the line? Okay, so that concludes the questions. I want to take a moment and thank our ASL interpreter. Today was a long day and she hung in there with us the whole time. So thank you to Stephanie. And we will be back on Monday with our next briefing.